One of the most common things I hear from families who've been sitting on the fence about home care is this: we just did not know what was going to happen if we called, so they did not call. If that is where you are right now, this video is for you. I'm going to walk you through exactly what happens after you pick up the phone, step by step, so there are no surprises. The first real step after your initial phone call is an in-home assessment. This is not a medical evaluation. It's not a test your parent can pass or fail. It's a conversation that happens in their home with an experienced coordinator, often a nurse, whose job it is to understand what is actually going on day to day and what kind of support would help. It's low pressure, takes about an hour, and there's no obligation to move forward after that. Here's what the visit actually looks like. The nurse introduces themselves to your parent or to any family member who is there. The more the merrier in these situations. They spend time talking directly with your parent about what a typical day looks like. Meals, medications, getting around, personal care, how they're managing each of those things. Then they walk through the home, not invasively, just to get a sense of the layout, stairs, bathroom setup, general accessibility. They also ask about preferences, what kind of schedule would work, whether there are any concerns about having someone come into the home, that kind of thing. At the end of the visit, they put together a care plan recommendation. It's a starting point, not a permanent decision. A lot of families adjust the schedule or the level of care over time as things change. One thing I always want to be clear about: the assessment does not commit you to anything. You can take time to think about it after the visit. As for who should be present, the most common setup is the parent and the primary family caregiver together. Some parents prefer to have the conversation on their own, and that's fine. Some families want multiple siblings on the call or in the room. That works too. If your parent has been resistant to the idea of home care, I would actually suggest framing the assessment as an informational visit rather than a decision. That tends to lower the resistance and make the conversation easier. After the assessment, we match your parent with a caregiver based on what we learned. Care needs, schedule, personality fit all factor into it. Our goal is to find someone who actually clicks with your parent, not just someone who's available. Once a match is confirmed and the schedule is set, the first visit typically happens within about a week of that initial call. Services start at a minimum of 3 hours per visit and 6 hours per week. Everything can be adjusted from there. So we do anything from 6 hours a week to 24/7. If you've been putting that call off because you were not sure what would happen, now you know. It's just a conversation. An experienced coordinator comes to the home, listens, puts together a plan. No pressure, no obligation. Give us a call whenever you're ready. The number is in the description below. And if this was helpful, check out the other videos on this channel covering things like the signs your parent may need help at home, how to talk to a parent who's resistant, and how VA benefits can cover home care for eligible veterans. With a grateful heart and mind, thank you for watching.